Thank you. It's been great to hear about some of the improvements for expanding access to rural healthcare, since I think that's what we're here to discuss. Rural access and VA, are we meeting veterans where they live? And I think there's some room for improvement. We've done good things that you all have mentioned, telehealth, mobile clinics, improving transportation service, that's great. But I, as a nurse practitioner, want to talk about an issue near and dear to my heart, and that's expanding the scope of practice for advanced practice RNs, nurse practitioners, nurse anesthetists, a lot of midwives. There's so many of us that fill such a void for healthcare, especially for rural health. So I know that the VA provided guidance for APRNs in 2016, and you published that report, and CRNAs specifically were left out of that. So nurse anesthetists were not allowed to practice to the full scope of their potential. So I wanted to just note some of the things from the guidance. Talked about expanding full practice authority for CRNAs would not harm team-based care, and that anesthesia care provided by CRNAs is equally safe with other physician supervision. This was from that 2016 report. Also in that report said the VA believes a significant shortage of anesthesiologists exists, and that this leads to cancellation delays of surgeries, particularly in rural settings. I know that after that time, the VA partnered with Temple University Beasley School of Law in 2022 for a VA commission study, which concluded the policy about CRNAs and decisions on their standards should be guided by current available data. The data provided in the study shows that removing restrictions on CRNAs had no negative impact on patients, may be a cost-effective solution to physician shortages, and may increase access to care. So in the wake of reports on canceled surgeries and the acknowledgement that 25% of VA facility chiefs of staff reported problems recruiting or hiring anesthesiologists, it is of the utmost importance that the VA reconsider their exclusion of CRNAs from their 2016 rule on the APRNs. Additionally, APRNs, including CRNAs, are typically more accessible to historically underserved populations in geographic areas, for instance, rural facilities, which are more heavily reliant on CRNAs for anesthesiology and surgical practices. So I guess my question is to Mr. Elena Hall. Can you just tell me why? Why are we leaving CRNAs out of the picture? This is a time when we need advanced practice nurses more than ever to fill those voids. They are capable, all of this data, and I could go on and on about proving that their outcomes are just as good, if sometimes not better, than some of the physicians we employ. So why are they left out of the equation?
Well, the first thing I'll do, Congresswoman, is identify myself with your support for advanced practice nurses. More generally, they've been some of my best colleagues in healthcare delivery personally as a physician. And I also want to clarify that our current policy is one where advanced practice nurses and CRNAs in particular, where our medical centers are in states that allow full practice authority for CRNAs. Medical centers do have the authority to extend privileges for full practice authorities in those states. And so we have many medical centers already doing this, consistent with that policy and consistent with state licensing guidelines. The question at hand with the national standards of practice is whether or not through our federal supremacy authority potentially override state licensing restrictions on those professions. And so that's the question at hand as we look at the national standard for CRNAs. My team tells me that just over the next year or two, we're going to see more data that would help in our final decision making on what that national standard should look like. And so we want to make sure we have the most up-to-date and important information for us to be able to take that extra step and say, VA, through its federal supremacy, will grant that authority regardless of what a state's licensing regime says. And that right now is still deliberative. I haven't made a decision on that, and my team has not recommended a decision on that yet.
Yeah, I don't know how much more information you need to have the outcomes be very obvious that we need these guys. We need them now because we're not providing the care to our veterans, especially in those rural health settings again. I come from Virginia, where we recently, only in the past few years, allowed for nurse practitioners as statewide to have full practice authority. But VA led the way. You guys did it first. So, you were brave. You went out there. You filled that void. I think you can do it in this instance too. So I will be watching as a member of this committee, as a nurse practitioner, and watching and waiting for you all to approve full practice authority for our CRNAs. And I know I'm running out of time. Actually, I only have 5, so I will yield, but thank you very much.